So every year, US clinicians burn 14 hours a week on prior authorization. $84 billion of admin costs, 1 in 3 denials get abandoned. The patient just goes without the care. So the buyer is the practice manager at a specialty clinic, ortho, oncology, infusion. So 200,000 of them in the US alone. They spend $30 to $120,000 a year per practice on prior auth labor. That is a 30 billion total addressable market sitting inside a workflow every clinic already hates. Hi everyone, my name is Yash Negi, CEO, co-founder of CanyonRift Evidence Finder. I built CanyonRift Evidence Finder. It is a native application that turns one prior authorization into a reviewable packet in under few minutes. So let me show you. So let's sign in using the demo credential. And you see, you already have dashboard, new run history, learning, and settings. So in settings, you can see you have already Fireworks AI API, TinyFish, MongoDB connection string. You have FHIR, R4 tenant, Medicare coverage database, and Honeycomb. All right, let's go into new run and let's say we pick anyone. So these are basically a complete identical representation of how the real clinic works. So let's go with adversarial trap spinal fusion. So you see member ID, full name, everything, and if you have submitted document, you can add that as well. So let's start the autonomous run. So you see it fires up the TinyFish API. On the left hand side, you see the agent activity log. On the right hand side, you see the live browser preview. All right, so you can just resize it. So basically, so as you just see are the settings that are already wired to a real production infrastructure. So Fireworks AI is used for LLM inference, TinyFish for browser automation, Honeycomb for live tracing, and MongoDB Atlas for persistence. So you just see there was this option FHIR. So this is the fast healthcare interoperability resources, the industry standard healthcare data API. Synthetic Cynthia data, so no real PHI, but the wire format is identical to Epic, Cerner, or Aetna. And you see also like I put no CSV upload, no copy paste, nothing. It works like that. So you pick the CPT code, Medicare, Aetna, United, whatever it is, it's work. So here is where the TinyFish is the core. So you see agents spin up in parallel self profile. Okay, so on the left you're watching the agent read Aetna or UHC node actual policy page in real time, and on the right hand side you can see it actually working. So Medicare never touches the TinyFish. So I ship the full CMS Medicare coverage database locally. 75,000 articles, 400,000 ICD-10 mappings, deterministic, free, and instant. And after a few minutes, you're gonna see a complete evidence binder, policy citation with source URL, a red team LLM predicting the denial reasons, and a printable submission packet ready for a human to review and click submit. So yeah, so to be honest, TinyFish is the only reason that this is working. So every peer portal is a JavaScript script rendered mess with rotating layouts, captchas, and session timeouts. A goal-driven agent that can see the page and click is non-negotiable. And to be honest, we have like 0 paid customer till now, 0 signed pilots, and we are not HIPAA compliant yet. So business associate agreement, a medical director of record, and errors and omission insurance are the next 90 days of work. So we have 3 warm intros to independent specialty clinic willing to run a 90-day free pilot, and an intro to BAA friendly healthcare council. And the reason why this is massive is every clinic in America has this pain. The human submit gatekeepers legally clean on day one, and prior auth is the last 6-figure admin line in the clinic that nobody has automated. So the clinic that tries it never go back. So you see, so now you can see the agent findings, everything, agent appeal letter. All right, and here's the game-changing thing. So it automatically gives you a very good overview of everything, and then you can later export the PDF out, and then you have the appeal letter, and it has followed the exact guidelines like a clinician and admin would do. So you see prior authorization appeal for anterior lumbar interbody fusion ALI-IF for member ID so and so, and dear appeal committee, and it created you a compiling case. And you see submission packet prepared. So human is still in the loop. At last it's gonna just check the packet reference, submission packet, everything. You see how beautiful it has organized everything. So yeah, so this is the demo of CanyonRift Evidence Finder. Thank you so much.